responsibility. One of them will help you to stand upright, okay? You are going to be able to lift the weight, you are going to jump, you are going to lift the vertebral column, this middle of the vertebral column. You are able to run, to walk, to jump, to lift the weight. And also another responsibility is to protect from vital and sensitive and important organ in your body. What's that? Spinal cord. You know the spinal cord superiorly is going to connect to the brain, and inferiorly is going to have 31 pairs of the nerve. That is 31 pairs of the nerve are going to spread in all distributed in all parts of the body. Now we can imagine that in the chest, in the thorax, some of the vertebrae that belong to vertebral column are going to participate. If you look at here, the orange part is going to remember you the thoracic vertebra. Thoracic vertebra are about 12 vertebra. But if I'm going to speak about orange of the vertebral column, you should remember it is going to go by 33 pieces of the vertebra. So 33 pieces of the vertebra are going to form the vertebral column for us. But from these 33, only the 12 vertebra, 12 pieces belong to the thoracic. Another part belongs to the cervical lobar. So 12 thoracic vertebra posteriorly, laterally, and anteriorly. How many pairs of the bone that we call rib or costa are visible in this slide? 12 pairs. So the chest anteriorly is going to form by the sternum, by the 12 pair of the costa or rib, and posteriorly by the 12 pairs of the vertebra. Do you get that? It's easy. Now, at the first, we are going to speak about the vertebral column. Look at this picture. This picture is going to remember you that the vertebral column anteriorly, laterally, and posteriorly. Anteriorly means you are going to look at the vertebral column in this way. Laterally means you Okay? Or, for example, I'm going to speak about the sternum. Another cartilaginous joint I'm going to show you and explain for you here. And in the lower limb, the teacher is going to explain for you the symphysis pubis is two hip bone and radially in the midline are going to make joint. We call symphysis pubis. This is again in the midline. It is the cartilaginous joint. So intervertebral is the kind of cartilaginous joint. About the synovial joint, I explained for you at the first. We have here, we have two ends of the bone. You know, these two ends are going to be such as each other. We have here, for example, the shoulder joint. These are which kind of the joint it is? And second, here we have prominence, here we have the sarcoma. They are going to make joint to each other. So, two ends of the bone are going to participate in the synovial joint. These two ends are going to be covered by the cartilaginous layer of the membrane. This is the cartilaginous. In your foot, have you ever have this experience at the end of the bone is different, the color with the body of the bone? Have you ever seen the bone in your foot?
Yes.
Both ends, for example, here. For example, here. Both ends is different. Yes, here the color, the histology is different from the body, from the shaft. Because these two ends we call epiphyses. What's the name of this part? Guts. The both ends are going to cover by the cartilaginous sheath of the layer. Now, opposite side, for example, we have here, imagine here we have another synovial joint. After to this synovial joint, we have a sheath layer of the tissue that we call capsule. If you want to look at to the two ends of the bone, we should remove this capsule. So other layer of this synovial joint, I am able to show you the capsule. Okay? Capsule. Inner layer of the capsule, we have synovial sheath. We have synovial sheath. What's the function of the synovial sheath? Prepare for us the synovial flow. I'm going to explain for you the synovial structure. This is the synovial flow. What's the function of synovial flow? Decrease the friction and another whole. You know the nutrition of it are coming to supply the bone, but it is short. It is not able to supply this part, the epiphysis. Here, the synovial flow is going to supply this part of the articular surface, this part of the bone. So decrease the friction and supply the nutrition for both surface, both end of the adjacent bone. After the capsule, which structure we have? Have you ever heard about a dense connective tissue we call ligament? Ligament is going to attach to this bone, after to the capsule, and go in the other side attached to the adjacent. Again, the ligament here is going to support and protect after layer of the capsule from this bone. Sometimes, for example, you put your foot here and suddenly make problem for your biggest joint. So we have some problem with the ligament. It's possible you have a bone of the ligament here. Sometimes it's possible you make problem here. So this ligament are responsible to protect, to support from the joint, from the bone, and decrease and prevent the suffocation. you have some muscle. You know the muscle. The muscle continuously, here is the muscular fiber, and each muscle are going to be continued by the tendon. Have you read that about the tendon? So we have the muscle here, or we have muscle here. The tendon and the muscle upper the capsule also are going to protect and support. For example, about the shoulder joint, what do you think? Which part of the shoulder joint will have the less protection of the muscle and the tendon? The subluxation of the shoulder joint commonly happen inferiorly, because anteriorly, superiorly, posteriorly we have a lot of tendon that protect. But inferiorly, the tendon of the muscle is less. So the subluxation of the shoulder joints usually commonly happen inferior. We get that. How many kind of the joint we have? Three. The fibrous, cartilaginous, and the sinus. Now, look at the vertebral column. In this view and table view, I'm able to show you in the thoracic region 12 pieces of the vertebra. And literally, which part of the vertebrae is there? The body. The adjacent body are going to reach the cartilaginous joint through the intervertebral disc. And in this view also, I am able to show you in each side of the thoracic vertebra a bony process. What's the name of this bony process? We call transverse process. Transverse process. So anteriorly, I am able to show you the body of the vertebra and transverse process. Look at the thoracic region. What happened to the transverse process from T1 to T12? What happened to that? It get larger? Yes?
No.
It is the transverse process. When I am coming down, it is going to get smaller. So you are in exam. It is possible I ask you, one of the questions. I ask you, all of the following statements are correct except. One of the statements is that such as this. The T1, the body of the T1, the body of the T1 or the transverse process of the T1 is shorter than the T5. Is it correct?
Yes.
No, short.
The T1 is longer than the T5, the transverse process. Yes, look here.
Yes.
The T1, the transverse process is long. In the thoracic region, when I am coming down, the length of the transverse process are going to get smaller, shorter.
Right.
So the transverse process of the T12 is smaller, shorter than the T8, than the T8. You get that? If in the anatomy you look at the picture and get in your mind, you will be able to answer to all of the questions. Okay? Because everything are visible in the picture. Now, again look at the thoracic vertebra. This time, compare the body. Look at the body of the T1. When I am coming down, what happened to the size of the body? They are going to get larger. So the body of the T12 is larger than the body of T11. The T11 is larger than the T10. Okay? So please pay attention. In your exam, I'm going to prepare for you about something that they are the, in fact, all of them are fact. Only you should remember. Which of the following statement is correct? The transverse process of T5 is longer than T7.
Wrong. Transverse is longer? Right.
The body of the T5 is smaller than T7. True. Now you be the teacher. You want to prepare some questions. A lot of questions you can prepare, the multiple choice question here. when they are coming down. For example, in lateral view, you can hear the lateral view. For example, in the lumbar region, we have a curve. This curve shape of the vertebra changing the intervertebral is anteriorly to this, the heart is more than the posterior. Now look at the thickness here and compare here. It's going to change. According to the size of the body, according to the shape of the body. That was a good question. Now, look at here. Imagine here is anterior. Here is anterior. Each part of the vertebral column is visible anteriorly. The body. We agree? The body is anterior. Now, posterior to the body, we have the vertebral arch. We have the vertebral arch. Now, I'm going to explain for you what happened to the vertebral arch. In the luteal time, in the fetal time, when you are in the abdomen of the mom, what happened to the vertebral column? At the first, the vertebra is not such as this. Something at the first, we have the cartilaginous structure. After that, something happened and this cartilaginous structure changed to the bony structure. Okay? Never see that in the fetal period, the heart is going to appear here on the small, and then it's going to get larger. No, it's not correct. At the first, some, for example, cells are coming here, joining to each other, making a tube. This tube is going to get, and at the end, the heart is going to the core. Okay? So during this process that takes time, a lot of factors can stop this developing and making the congenital disease. Do you get that? So at the first, a baby, when the baby is going to form, we have one cell, very soon it divides to two cells, very soon divides to four cells, okay? And then it is going to be such as this, and then all of the structure are going to be developed. At the end, you have a baby. Now you should remember that the most sensitive, most important part of your period of your life is when you are in your time of the one. So you are going to be the mother and the father in the future. You should remember the most important period of our life is the fetal period. If the mother, for example, uses some drug or don't have enough and good nutrition or something happens, it is possible this development starts and the congenital problem are going to happen. Perhaps you think after the delivery I'm going to give a good care of the baby to become very strong. But you should know from the fetal period, from the first time that you think you are going and you understand you are going to have a baby, it is important and you should be careful. Okay? Now, about the bone, about the vertebra, what happens? The body anteriorly, posteriorly, we have vertebral arch. What happens to this vertebral arch? At the first, this vertebral arch in each side is going to be formed by two half of the curve. And when we call pedicel. We call pedicel. These two pedicels are going to connect to the body of the vertebra, to this part of the body, and rear part or posterior part. This half of the curve posteriorly we call lamina. We call lamina. Posteriorly, both lamina join together and making a process we can call spinous process. We can call spinous process. So each vertebra consists of two pedicels, two lamina. How many spinous process? One. You know the tip of the spinous process in the midline Superiorly, we have superior articular process. And inferiorly, and not able, because this is not three-dimensional. Inferiorly, we have inferior articular process. So it is that from the connection of the pedicle and lamina, we have three processes: transverse process, superior articular process, and inferior articular process. Now, normally, each vertebra consists of one body anteriorly, two pedicle, two lamina, one spinous process, two transverse process, two superior articular process, and two inferior articular process. Here we have a foramen. We can call vertebral foramen. What do you think? What is the content of vertebral foramen? Spinal cord. So here we have spinal cord. Okay? We have the spinal cord. Now, around the spinal cord, we have three layers of have you ever heard about the dura mater? How many? Meninge. We have three layers of meninge around the spinal cord. The spinal cord is inside of the vertebral column. Now, each vertebra has vertebral foramen. And when these vertebra are going to join inferiorly and superiorly, this foramen continuously are going to form for our canal. Okay? 33 bone you have, most of them has foramen, vertebral foramen. When we are going to make two together, this foramen are going continuously make for us the vertebral canal. Inside of the vertebral canal we have spinal cord. How many spinal nerves we have in our body? 31 hairs. We have 31 hairs. How many cranial nerves we have in our body? 12 hairs. Okay? 31 hairs of the spinal nerve, 12 hairs of the cranial. Do you have any question here? Never hesitate. If you have any question, I'm ready to answer. If you want to repeat, if you want to explain more, never hesitate. Tell me. Because during the semester is your time. You can use. Only about the final exam. Before the final exam, the short time is my pen. I use my pen like you can use from your pen during the semester, so every time you have any question, never hesitate, don't hesitate to ask me. Now we go here in the anterior view. I am able to show you which part of the vertebra or vertebral column body, intervertebralis, and this process. What's the name of this process? In the lateral view, I am able to show you the body of the vertebra, the spinous process, and the transverse process. Okay? Transverse process, the spinous process. Look at the thoracic vertebra. In the thoracic vertebra, we have to the spinous process. The spinous process in the thoracic vertebra are long and narrow, and they are going direction is inferiorly posteriorly. They are going to overlap to each other. Okay? Overlap to each other. Now, we come down in the lower region. What happens to the spinous process? They are broader, okay? They are flat. They are going horizontally, not obliquely downward. They are going horizontally. So, they are not going to overlap to each other, but in thoracic region, they are long and they are going direction backward and inferior and overlap to each other. Now, I want to access to this space. In the thoracic region, if I pass a needle, this form of the spinous process are going to prevent the tip of the needle inflammation. Some patient come to the emergency room and you are at the emergency room that time. You see, perhaps a virus is responsible for this fever or this sign. So I need a sample of the CSF. What is CSF? Spinal. Cerebral flow. How can I access to the CSF? I can use from the LP. LP means lobar puncture. Means I can use from a needle, pass this needle between a spatial position. Pass a needle, pass this needle here in lumbar region, and easily, without any problem, without any wall of the bone, I will be able to access to the vertebral canal. But here, if I want to pass a needle, the guard at the first think about that. This bone prevents the bone to pass, because this bone prevents. One in the lumbar region, this is here, I am able to pass the needle. It is one of the reasons. Another important reason is here. You can hear, we have vertebral canal in our body. We know one of the content, one of the vital and important content is the spinal cord. Imagine it is the vertebral canal. As you know, inside of the vertebral canal, we have a spinal cord. The spinal cord, at the first, it is here, in the baby. Inferior part of the spinal cord is at the level of L3, the third lumbar vertebra. From the third lumbar vertebra, the spinal cord here is going to be continued by a thin layer of the fiber of the nerve we call filum terminal. So here we call the spinal cord in the baby at the level of L3. We can find the inferior end of the spinal cord. Here the spinal cord is going to be continued to the coccyx with a thin layer of the fiber nerve that we call filum terminal. I told you 31 pairs of the spinal nerve we have in our body. I am going to draw some of these nerves. Superior nerve are going to leave the vertebral canal. They are the first one, second one, okay, third one. They are going horizontally and leave the vertebral canal. Now I'm going to come inferiorly. In the middle part, this spinal nerve at the first has obliquely and then leave the vertebral canal, not horizontally. Come down and then leave the vertebral canal. Inferiorly, this nerve at the first come vertically and then leave the vertebral canal. Inferiorly, they come inferiorly and then leave the vertebral canal. Look at here, middle central we have filum terminal. Around them we have inferior spinal nerve. They are going to form a shape such as the tail of the horse. Okay, here is the same that such as the tail of the horse. We call coda equina. We call coda equina. Centrally we have filum terminal, and around this filum terminal we have inferior spinal nerve. If I pass a needle here, the bone prevents, and I can't access to the vertebral canal. At the first, the bone prevents, but if I can be able to go inside of the vertebral canal, the needle comes here and making injury for the spinal cord. And you know, if any problem happens to the spinal cord, you are going to miss some of the skin. Now, inferiorly, if I pass a needle and access to the vertebral canal, here is not the spinal cord. All of these thin layer of the fiber are going to stay inside of the CSF. needle make problem or make injury for this nerve because they are very thin and we are going to swing. You get that? So, two reasons that one of them is so important. We should not, it is forbidden to make a sample of CSF superiorly because here we have the spinal cord. Inferiorly, we can. We have permission because here the spinal cord is not appear and also here the between two adjacent bone the space is larger and I am able to pass the needle. So we call LP, lumbar puncture, not TP, not CP. Okay? LP means lumbar puncture and it is better. Lumbar puncture is going to be done inferior, for example, between L4 and L5, inferior, not between L2 and L3, because in the baby, in the L2 and L3, we have spinal cord. Now, look at it, listen to me. In human, when the vertebral column is going to grow, develop, it is going to grow faster and longer than the spinal cord. So the length of the vertebral column is longer than the spinal cord. In the adult, inferior part of the spinal cord, in adult is at the level of L2. In the baby is at the level of L3. So in the baby you should be careful about the lumbar puncture, which is better you come down and pass the needle. In the adult, because the inferior end of the spinal cord is as L2, so the range of the LP is longer. Then when a human, a patient comes to your office, you should notice to the age of the patient, to the baby, to the adult. Sometimes in the sex is female or it is male, sometimes it's some another process. But for the LP, the age of the patient is important. Now, look at this picture. This foramen, connected to vertebral foramen, connected to this one. In each side of this foramen, in each side, we have intervertebral foramen. What's the name of this foramen? Intervertebral foramen. What do you know? What do you think? From the intervertebral foramen, which structure are passing? This is the intervertebral foramen. Which structure are passing? Spinal nerve. Okay? The spinal cord is inside of the vertebral column. We have a pair of the spinal nerve, 31 pair of the spinal nerve. How these spinal nerve are able to access outside and leave the vertebral column through this intervertebral foramen. Now, anything happen to this intervertebral foramen and make them smaller, they are going to compress the content of this intervertebral foramen. What is the content of this intervertebral foramen? Spinal nerve. For example, a patient has a fracture to the body of the vertebra here, or body of the vertebra here. This fraction are going to compress all of the content here. Or sometimes, in some of the patients, you have herniation of intervertebral disc. What's the herniation? Means this intervertebral disc is going to destroy. Central part of the intervertebral disc, we have a gelatinous structure. Sometimes this intervertebral disc is going to get destroyed, fractured, and this gelatinous part come out, making smaller this intervertebral foramen and compress all of the structure, all of the content of this intervertebral foramen, and making pain for the human, for the individual. It depends that here upper limb? No, because in the upper limb you read about the brachial plexus. Here the nerves are going to make brachial plexus and they are going out and they are pressing. But inferiorly you have problem here. So the nerve inferiorly that are going to make plexus and they are responsible to innervate the lower limb are going to compress. So the patient have pain in the lower. Do you have any question? Are you able to answer to some question?
Excuse me. So we can't have a sample within the spinal cord above L3 for infant or adult.
I told you. At the first, the structure of the vertebral column prevents. You can think that the gut is going to protect the spinal cord. Okay? So the bone are here, such as this. You are not able to pass a needle here. It is going, if you want to pass the bone, prevent. But in the lower region, the bone, between the spinal process is such as this. You can pass the needle easily here. You can pass, and you have television because here in the lower region, inferiorly in the infant and in the adult, you don't have spinal cord. You have the phylloperennial. Phylloperennial is so thin and narrow fiber, but the spinal cord is such as this. Imagine here we have a column, and imagine here you have some thread, okay, and put inside of the glass of water. These threads are swimming inside of the water. Now, if I pass a needle here, it is dense and it is not going to swim. So the tip of your needle is going to make problem here. But if you come down, this thread inside of the water is going to swim. Really, it is possible the tip of your needle making problem and making injury for this thread, for this fiber. So you are not, you don't have any permission to pass the needle superiorly. I told you everything. Everything means in lumbar region you have permission. I never say to you TP, okay, thoracic, or CT, cervical. Only L. And in the L come inferiorly. In the infant, inferior to L3, in adult, inferior to L. I answer your question. It is so easy. Only you should look at the picture anatomy to get in your mind in all of the surgery, in all of the exam, you can remember the picture and answer the question. I'm not going to bring and prepare for you the question from the space. I'm going to prepare for you something that I'm going to explain in the class. Of course, please pay attention. When you are going to be asked at the first a very small, very little, think, then answer. At the first, think about the question. Is it positive? Is it negative? It is going to ask you what? Most of the time, you know the answer. Only you want to choose the very fast and make mistake. For example, it is possible. I ask you, it is 212, it is 11, it is that. It is possible. I ask you about the body. Sometimes I'm going to ask you about the transverse process. It is different. About the transverse process, we know superior to inferior, it is going to get smaller. So transverse process of the T10 is longer than T11. T11 is longer than T12. But about the body, from the superior to inferior, what happened to the body? They are going to get larger. Why? Because they have to balance the weight, the pressure. So they are going to get larger. Now look at here. Later, you are going to read about the lower limb. Look at here. The F5 compared to the body of F4. Which of them the body is longer?
L5.
The L5 is going to make joint with the first bone of the sacrum. Here, the sacrum in each side is going to make joint with the hip bone. We call the sacroiliac joint. Here, the pressure, the weight is going toward to lower hip. So the S2, S3 are not responsible to tolerance the weight, the pressure. The S1, yes, it is responsible. The S1 is large, but the S2, S3 are going to get small. ببینید پنج تمام وزن و فشار رو میده به اولین نمره ساختمون، اونم میده به استخوان‌های لگن و اندام‌های تحمیلی. خب پس اینجا دیگه انتقال پیدا کنیم به اندام‌های تحمیلی S2 و بعد مسئول این کار نیستم و دارن این سبب وجود دارش. خب
سه تا پنج داره نه؟ یک تا پنج داره.
پنج تا نمره داره ساختمون به هم رسیدن. اولیش بزرگه، چرا برگردش کوچیک میشه؟ چون مسئول انتقال وزن و فشار نیستن، مسئول تحملش نیستن. اما اولیش همه این وزن و فشار رو میگیره میده به لگن، لگن هم میده به اندام‌های تحمیلی. اندام‌های تحمیلی هم میدن به گراف. خب So anteriorly, laterally, and posteriorly, when we look at the vertebral column, we are able to find some part of the vertebra. Anteriorly, the body, the vertebra and transverse process are visible. Laterally, the body, intervertebral foramen, transverse process, spinous process are visible, and posteriorly. When we look at posteriorly to the vertebral column, which part of the body are visible? Transverse process, lamina, spinous process. Look at the spinous process posteriorly in the thoracic region. The spinous process are long and they are narrow and overlap each other. The lamina also overlap each other. If we do adjacent lamina, we can't find any space to pass the needle. We go inferiorly to the lumbar region. What happened to the spinous process? They are going horizontally. Between two adjacent lamina, we have the space. This space helps us to be able to pass the needle. And when we come down, this space are going to get larger, and so we are able to pass the needle easily. And also here, inferior to the lumbar region, we cannot find any part of the spinal cord, and this is an important factor, important reason. Answer to this question, which part of the vertebra is visible in three anterior, lateral, and posterior view? Transverse process. Posteriorly, are you able to look at to the body? No. Anterior, are you able to look at the spinous process of the lamina? No. Laterally, are you able to look at to the lamina? No. Only posterior I am able to show you the lamina. So looking at the picture are going to help you to remember a lot of things. We have some curve, that this curve, this form, this shape of the curve, S-form, this S-form is important. When I am going to speak about the S-form, means that this S-form are going to help to us to dance, to jump, to run without any problem. Have you ever heard about the pain? Pain is a good sign, an important sign. When you have pain, you are going to see about something wrong, for example, in the lumbar region. Something changed, gone wrong, for example, in the cervical region. When you put your hand in the fire, which sign helps you to remove and pick up your hand? The pain. So if you have any pain in the vertebral column, it is going to remember you, it is going to alert you that you have some problem here. Please think about it. You go to the doctor, take the radiography and find the problem, the reason. Okay? So pain is a good sign. Without the pain, for example, in the cancer, why the cancer is going to progress and we cannot find it, and we can find it late? Because most of the time it is without the pain. Okay? So the pain is a good sign. Now, about the S-form shape of the vertebral column that help to us to do a lot of activity. If you imagine, here is the anterior, and you're going to look at to the vertebral column of knee. In the cervical region, you have anterior curve. In the thoracic region, you have anterior concave, which is anterior convex. In the lower region, again, you have anterior convex. And in the sacral region, you have anterior concave. It is S-form. S-form curve. Okay? Now look at here. In the lateral view of the vertebral column, in lateral view of vertebral column, we have anterior convex in the cervical region, anterior concave in the thoracic region, anterior convex in the lumbar region, and anterior concave in the sacral region. This S-form shape curve are important and help to us to be able to straight upward, okay, and jump, run, and we are going to walk and never had to walk before for one foot. And sometimes we have problems. It is considered in some of the problems, some of the disease, some of the patients, you order the radiography and the specialist write for you that in the cervical region the curve increase in your patient. So the reason of the pain here is the increase of the curve in the cervical region. What happened? We have in the cervical region convex and anterior. Sometimes this convex increase because cervical lordosis. Cervical lordosis. In the pregnancy, when you become fat, what happens? In the fat, the abdomen comes upward, and here the curve increase. Yes, when you stand in the mirror, you find that here the curve increase. After the pregnancy and you have diet and remove this, in fact here, this lordosis that we call the lumbar lordosis disappear. Lumbar lordosis means the anterior curve increase. So anterior curve in the cervical region we call cervical lordosis, anterior curve increase in the lumbar region we call lumbar lordosis. I'm sure that all of you have seen sometimes in the thoracic region the posterior curve increase we call kyphosis or kyphosis. Okay? It's such as this kyphosis. You are so young and you are going to read a lot of time to become a doctor, a specialist. Be careful about your health. When you are going to stand, it is better you stand upright. Okay? Later, we are going to speak about the muscle in the back. Some of the muscle take these two scapula near the spinal column, near the vertebral column. It is better you make a strong these muscle. If you sit on the chair, always, all the time, and go here, okay? You are going to make weak this muscle. It is better after sometimes you do some exercise to make active this muscle. Later you read about the trapezius. Trapezius help to you to, for example, in the military, you stand here. with making weak this muscle, then your shoulder is coming down. Okay? So be careful about your hips. It is better when you are going to stand, you may equal your weight in moves slowly, such as this. But I'm not going to control. Sometimes I'm going to stand such as this, okay? Another time such as this. Not good. Perhaps in the limited time, in the short time, nothing happens. But with the time, long time, I'm going to make problem for my vertebral column. Because this curve normally are going to decrease the weight and decrease the pressure. When I am going to change this curve with this form or this form, with the long time I'm going to make in some part of the vertebral column increase the pressure. In the short time nothing happens, but in the long time here is going to get problem. So be careful. I'm sure you know. It is better when you are going to sit on the chair, your back touch the back of the chair. But I'm sure after some time you slide down, okay? Perhaps just not. You come such as this. With the time, with the long time, it is going to make problem for your vertebral column. When you are going to lift the weight, it is better, for example, it is better you make 2 equal, okay, to bag, for example, and change. 2 kilograms here, 2 kilograms here. But I know that most of us, I'm sure, and you have this experience, you take 10 kilograms with one hand, okay? You know, and it's bad for your health. Because you are going to be down here. All of the person are going to look at your structure of the body. Imagine you go to the office of the doctor, for example, the skin, and he or she have a lot of problem in the skin. You come out, okay? Because at the first, he or she should be able to care of her or his skin after that. So be careful about your structure, about your health, it is important. Always I tell to all of the students, it is better the day or the night before you come to the class to imagine and see how many breaths I have. For example, 2, 3, or 4 breaths, not all the time, all the day. For the first breath, I'm going to eat, for example, to drink the water. You think about that. Or prepare something to bring to the university. It is important. I never think that you are a very hungry person. And I respect that it is a good culture that think about the person. And with the time, I remember I explained for you. Now, look at today another thing here. This is the lateral view, anterior care, convex anterior cervical region. To care, look at here the thoracic region in the sacral region. To concave anteriorly, posterior to this central column, and to concave, and to convex anteriorly. Any feature that change this curve in the long time are going to make a problem for you. Now look at here. At the first that the baby, after the delivery, I'm not sure, perhaps you have this experience. After the delivery, during the first 2 to 3 months, the baby infant, when you want to pick up, to lift the baby, you should put your hand at the back of the head and the neck. But after 3 months, if you give your finger, your hand to the baby, he or she is able to pick up her or his head by himself or herself. What happened? At the first, after the infant, we have 2 care. For during the infant, during the fetal period, you have 2 care. Both of them concave and pelvic. So after the delivery, in the vertebral column, we have 2 care and pelvic. after 2 or 3 months, the first convex anterior in the cervical region happens. At the end of the first year, you see that the baby stand and start to walk. What happened? The second convex anterior happened in the lumbar region. So the convex anterior at the first happened in the cervical region. At the end of the first year, the second convex anterior appear in the lumbar region. Now, this picture that concave anteriorly we call primary care. After the birth, after the delivery, 2 convex anteriorly appear in the cervical region and lumbar region. We call secondary care. Okay? The primary care, most often concave anteriorly. After the birth, 2 convex care appear in the vertebral column. The first one in the cervical region, the third one in the lumbar region. Now, how many pieces of the vertebra we have in our body? 33. In the cervical region, we have 7. Used from the C1 to C7. In the thoracic region, we have 12. Used from the T1 to T12. Inferiorly, which part? Lumbar region. L1 to L5. Inferior to L5, we have sacral region. We call S1 to S5. Inferior, we have coccygeal region. We have C1 to C4. How many?
33.
33. 4, 5, 5, 12, 7. 33. Okay? But after the birth,
Does the coccygeal sometimes different from person to other?
here,
No,
yes,
different between people.
difference
The
between
number of coccygeals.
what?
The number of coccygeals is different.
Number, yes, it is, look at me, we are going to speak about the common piece of the vertebra. It's possible, for example, in the coccygeal region, we have 5 pieces, or we have 3 pieces. But normally, commonly, they have 4 pieces. Okay? They have abnormality a lot in the vertebra. But normally, in the human, they have this 4, definitely. Now, you know, in the cervical region, how many vertebrae we have? 7. Have you ever seen about the giraffe? How many? Again, 7. But it's not. Okay? It is not. For us, between the brain and the thorax, they are near each other. The giraffe is far from each other. Okay? With the time, because of the environment, because of the nature, something happened and this bone become larger and longer. In the elephant, in the mouse, in the rat, again they are separate. Okay? Now, here we have 7 in the cervical region, 12 in the thoracic region, 5 in the lumbar region, 5 in the sacral region, 5 in 4 in the coccygeal region. Become 33 pieces. But in the adult, in the baby it is 33. But in the adult, something happens. This bar, S1 to S5, fuse together, join together, and decrease to 1. How many decrease?
4.
In adult, these 4 fuse together, join to each other, and become 1. So 33 change to 26. In our body, we have 26 pieces of the vertebra. You know what happened. Okay? These 5 can fuse together, these 4 fuse together, so in our body we have a triangle and broad and large bone that we call sacrum. We have a triangle and a small bone we call coccyx. Normally, the coccyx, look at here, normally here, look at the sacrum. This is the sacrum, anteriorly. This laterally, this posteriorly. Posteriorly, anteriorly. Artery, the same? No. Anteriorly, this is smooth, posteriorly, this is broad. Anteriorly, we know the first sacral vertebra is small, larger than a spine. And we know at the first, it consists of 5 parts. So I'm able to show you 4 horizontal lines. These 4 horizontal lines. Remember me that at the first, it consists of 5 pieces. When I look at the coccyx, we can find a small triangle bone. We know that these 4 things together, so I'm able to find how many horizontal lines? 3 horizontal lines help me to remember that at the first, the coccyx consists of 4 pieces of the separate bone. Do you get that?
Yes.
Do you have any question? No. Cool. Look at here. What happened? It is the kyphos, which position with the oviposition. And it is the lordosis. We can to the lower region, the curve increase. What is this? It is a scoliosis. It depends that I am the right hand or I am the left hand. A little curve to the right or left is normal. But the lateral curve, if increase, make problem. We should do something to favor the surgery. We call it a scoliosis. It is a scoliosis. A scoliosis is an abnormal form and is going to make problem for the patient. Here, again, you are going to look at to the scoliosis, lateral curve, to the kyphos, means the posterior convex in the thoracic region, and lordosis, it is possible happen in the lumbar region, it is possible happen in the cervical region. Both of them making pain for the patient. The patient comes to office and, for example, explain for you, I have problem here or problem here. You order the radiography. After the radiography, the specialist write for you that a little care, a little lordosis. For the more care, more lordosis, the cervical, the lumbar region is active. Or herniation is active. What is the herniation? What's the means of the herniation? Or here, look at here. It is again the scoliosis, and here you are going to look at to the scoliosis and kyphos. We have so many grades of this problem. It is a bone, it is a vertebra. What's the name of this part? Vertebral body, vertebral wall. Vertebral wall consists of 2 pedicel, 2 lamina, 1 spinous process, 2 transverse process, 2 superior articular process, 2 inferior articular process. And here the lumbar region, and again the last thing for today, and this class, we have the pedicel, is lateral view. Superiorly we have a notch, inferiorly we have a very large and deep notch. So remember the pedicel. In superior border or inferior border, which of them we can find a very deep notch and large notch? Inferior, superior, inferior. Okay, this picture is made to remember you. Tomorrow at the first, I'm going to ask you some questions about the today's lesson. So please prepare yourself. Tonight, all of you should read and study by yourself. Look at here, you answer to this question. It is to adjacent vertebrae. Here is the intervertebral foramen. Here is the vertebral foramen. What is the content of vertebral foramen? Spinal. What's the name of this protected sheath? Dura mater, anatomy, and the pia. Which of the layer is near the spinal cord? Pia. Now we have 30 pairs of the spinal nerve. Some of them are visible here. Some of them are visible. This space that you can find somewhere, this space is upper to the dura mater. We call epidural space. Now here, one of the nerve in one side is passing through the intervertebral foramen. Intervertebral foramen, vertebral foramen is different. We get that vertebral foramen, intervertebral foramen. The spinal nerve are passing from which foramen? Vertebral or intervertebral? Intervertebral. It was one of the questions. I'm not really sure that which semester, but one of the questions was here. Look at the intervertebral foramen. Superiorly, inferiorly, they are going to be bonded by the pedicel. I told you the pedicel inferiorly has a deep notch, and the pedicel superiorly has a very small notch. These two are going to form the superior and inferior boundary of this intervertebral foramen. What's the name of this? Body. What's the name of this? So, intervertebral foramen and heavily bonded by the two adjacent body of the vertebra and intervertebral foramen. What about posteriorly? It is going to be bonded by a joint. This joint is between the inferior articular facet of superior vertebra and superior articular facet of inferior vertebra. Okay? Imagine it is the superior vertebra has two articular facets, superior and inferior. This vertebra again has two facets, superior and inferior. This superior facet of inferior vertebra is going to make a joint with the inferior facet of superior vertebra. Here, it is a synovial joint. Which kind of the joint is here? Which kind of the joint is here? Now, it is possible your exam, I ask you, which of the following statement is correct? Intervertebral is superior, inferiorly bonded by the pedicel. Correct. Anteriorly bonded by intervertebral disc and the body. Posteriorly bonded by the joint. The name of this joint we call zig apophyseal joint. This is the name of the joint between the inferior articular process of the superior vertebra with the superior articular process of the inferior vertebra. It is a kind of synovial joint. Each of these structures, herniation of the disc, broken of the or fracture of the body, pedicel, or any problem about the zygapophyseal joint making short and small this intervertebral foramen. We know one of the content that has from the intervertebral foramen is the spinal nerve. It belongs that this intervertebral foramen making problem over here. In each of the part, if any intervertebral foramen making and become smaller, compress the nearest nerve, and the pain is going to be felt in the length of this neck. We get that? Okay, 15 next step.